Hello, my name is Peter, and today I'll be talking about the need for safe injection sites, especially in Ottawa. To start this presentation, I'll focus on a little history of safe injection sites in Canada. During the mid-90s, British Columbia was struggling with an overdose crisis. A task group was formed and the Kane Report was created. This led to a number of recommendations based off of European models. Thanks to the Kane Report, local interest was growing in Vancouver, especially among people who inject drugs. This led to the first unsanctioned safe injection facility called Back Alley, which served over 100 people who inject drugs every night. But this site was eventually closed after a year of service. Skip to 2000 and 2001, the city of Vancouver releases its four-pillar drug strategy. This policy was based on Western European models, which use prevention, enforcement, treatment, and harm reduction. However, this was only a city policy, and provincial backing was needed. The four-pillar strategy was about to create further public awareness. In 2002, the Dr. Peter Center started to supervise injections and was backed by nursing associations who explained they had an ethical obligation to prevent harm, even if the injected substances were illegal. Now, jump to 2003, and Insight becomes the first federally approved safe injection facility because of an exemption from the Health Minister of British Columbia. The site has 13 spaces and operates 18 hours out of the day. The main condition for Insight was that it would be heavily evaluated. Insight was able to show that it decreases public disorder, infection, disease transmission, and overdose, while also providing external programs for detoxification and addiction treatment. Over 40 peer-reviewed articles were created due to the effectiveness of the site. Insight did come under a lot of pressure from abstinence-based drug treatment groups and the Conservative government of 2006, who opposed the Insight project. When the Conservatives attempted to close down the site, the issue was brought before the Supreme Court, and on every occasion, including appeals by the government, judges of the court sided with Insight because the court recognized that safe injection facilities are a health service that actually saves lives. Now skip to September 2017, and Ottawa opens its first site, the Clarence Street Safe Injection Site, which is run by Ottawa Public Health. I wanted to touch on a brief history of safe injection sites in Canada because it's important to know how safe injection facilities gained recognition in the face of adversity, and that these sites are now seen as a necessity in order to save lives. Now let's get into some facts about safe injection sites. I'll start with Insight, which is located in Vancouver, and I'll transition to facts about Ottawa's safe injection sites. Insight has been able to prevent at least 35 HIV infections per year. Nobody has died at Insight due to an overdose, and within Insight's proximity, there has been a decrease in fatal overdoses by 35%. 30% of Insight users enroll in drug addiction treatment, and in 2010, 458 clients used rehabilitation services. Insight has neither increased drug use or crime within its vicinity. Now, let's turn to Ottawa. The rate of HIV and hepatitis C for people who inject drugs in Ottawa is one of the highest rates in Canada. 1 in 10 people who inject drugs will get HIV. 6 in 10 people who inject drugs will get hepatitis C. According to the CSCS, Campaign for Safer Injection Sites, in a single year in Ottawa, nearly 6,300 needles and 1,200 crack pipes are collected off the city streets. These facts show the need for safe injection sites in Ottawa, and now let's discuss some of the numbers safe injection sites in Ottawa produce. In 2018, 72,015 visits were recorded for all 4 sites in Ottawa. In the same year, 566 naloxone treatments for overdose were used, and oxygen was given 599 times, and paramedics only had to intervene 62 times. Across the whole city of Ottawa, there were 446 emergency room visits for opioid overdoses. From January to June of 2018, only 28 opioid deaths were recorded versus 64 deaths in 2017, when there was only 1 safe injection site in Ottawa. The cost of treating HIV for the average person is around $250,000. If 10 people are prevented from getting HIV in Ottawa from a safe injection site in a single year, this will save our healthcare system $2.5 million. The cost of treating hepatitis C is estimated to be $22,000 per year. If 35 people are prevented from getting hepatitis C from using safe injection sites in Ottawa in a single year, this will save our healthcare system $770,000. To give an example, the Clarence Street safe injection site cost $996,000 to operate, and if you factor in healthcare savings of prevented HIV and hepatitis infections, this would equal $2,274,000 saved by a single site. There are four main sites in Ottawa, not including the Mobile Treatment Center. Clarence Street site is operated by Ottawa Public Health, the Ottawa Inner-City Health Trailer, otherwise known as the Trailer, the Sandy Hill Community Health Center, and the Somerset West Health Center. The Trailer is by far the busiest site with over 50,000 visits between November 2017 to March 2019. To give these numbers some perspective, I live in Carleton Place, and it's estimated that 35,000 people live here. All four safe injection sites have served 70,000 people in 2018. It's easy to do the math, but these numbers show how entire communities are served through these sites. Now that you've learned some history and you heard some facts and numbers, I hope you agree that safe injection sites are crucial service within cities. Ottawa's four sites help multitudes of people by preventing HIV and hepatitis C infections, preventing deaths caused by overdose, preventing drug use and litter, and providing health and social services in terms of treatment of addictions. I want to say thank you for taking the time to watch this video, and I hope this information will help you to support safe injection sites, especially within your vicinity if you're not in Ottawa. But especially if you're in Ottawa, I want you to recognize the importance of what these sites do and how they're a crucial service to our city. All right, and thank you for listening.